Hi, I am Dr. Saqib Mansoor, and today I will discuss with you the Osgood-schlatter disease. And this is an inflammation of the patellar ligament of the tibial tuberosity. And here you could see this is a normal insertion of the patellar ligament at the tibial tuberosity in the ossifying tibial tuberosity. This is various processes that occurs during the disease that will sum up in the end. And yes, this is Osgood-schlatter disease and apophysitis of the tibial tubercle. This is the term used for that. And what is apophysitis? An inflammation of a tubercle. It mainly affects growing children with overuse of the affected tubercle. So, what is the apophysitis of the tibial tubercle? It is also called as I told you, Osgood-schlatter disease. It is the inflammation of the patellar ligament at the tibial tuberosity, characteristic in the painful lump just below the knee that is worse with activity and gets better with the rest. One or both the knees could be affected and flares can occur. So Osgood-schlatter disease is one of the commonest causes of the knee pain in active adolescents. The disease is believed to be caused by repeated traction on developing ossification center at tibial tuberosity, which results in tenderness, inflammation, or multiple subacute fractures. The disease is benign and self-limiting, one that commonly disappears within a year. Pain can persist for 2 to 3 years until the tibial growth plate gets closed in late adolescence. Persistent complaints of pain can be due to bony ossicle formation in patellar ligament. That I will show you with the picture, the bony ossicle formation. Here you could see this is the Osgood-schlatter disease with its radiograph. Here you could see this two small arrows in the big arrow, the prominence of the tibial tuberosity. This is the double arrow. This is the prominence of the tibial tuberosity and elongated and fragmented. This is you could see the fragmentation of the tibial tuberosity. Sorry, yes, here you could see this with overlying soft tissue swelling. What are the symptoms of the Osgood-schlatter disease? Intense knee pain. This is usually the presenting symptom, which occurs during activities such as jumping, running, and during kneeling, squatting, lifting things, and especially ascending or descending stairs. The pain gets worse with acute knee impact. The pain may be reproduced by extending knee against resistance, by stressing the quadriceps, or by striking the knee. At start, pain is mild and intermittent. The pain is severe and continuous in the acute phase. The impact of the involved area is very painful. Bilateral symptoms are seen in 20 to 30% of the people. Risk factors. What are the risk factors? Risk factors include the overuse, especially sports which involve running or jumping. The underlying mechanism consists of repeated tension on the growth plate of the upper tibia. It is also seen usually in male pole vaulters that have ages of 14 to 22. And how you diagnose it? Diagnosis is established on basis of the signs and symptoms usually. The ultrasonography, this can visualize many warning signs that are predictive of the disease, and the test detects if there is a tissue swelling and cartilage swelling. What are the various types of the disease? Three types are usually believed to be there, and these are avulsion fractures. I've told you it can result in avulsion fracture where the tibial tuberosity gets separated from tibia, commonly remains connected to a ligament or tendon. The injury is not common due to the presence of the mechanism that prevent strong muscles to inflict damage. The fracture in the tibial tuberosity may be a complete or the incomplete break. So the type 1 of the Osgood-schlatter disease, a small fragment gets displaced proximally and no surgery is required. Number 2, type 2, articular surfaces of tibia is intact and the fracture takes place at the junction where secondary ossification center and the proximal tibial epiphysis come on together. It may or may not need surgery. This is the proximal tibial epiphysis. And type 3, a complete fracture through articular surface that involves high chance of damage to menisci. This fracture type usually requires needs surgery. So the differential diagnosis, DD. Sinding-Larsen and Johansson syndrome is a similar disease involving the patellar tendon and the lower margin of the patella bone and not the upper margin of the tibia. Sever's disease is a similar disease involving the Achilles tendon attachment to the heel. How to prevent the disease and how the quadriceps muscle be stretched. One of the important ways to prevent the OSD is to assess the participants' flexibility of their quadriceps and hamstrings. Lack of flexibility of these muscles is a direct risk factor for the Osgood-schlatter disease. Muscle may shorten, that can bring about pain, but this is transient. Stretches help to reduce shortening of the muscles. The main stretches used to prevent the disease involve the hamstrings and the quadriceps. Direct stretching of the quadriceps may induce pain. To use of use of foam rolling for self myofascial release helps gently restore the flexibility and range of the movement. So very important how we treat the disease. Treatment is usually conservative with ice, rest, and specific exercises being advised. Recommendation of simple pain medicine like NSAIDs such as ibuprofen or acetaminophen, the paracetamol. And the saline injections have also been used for pain reduction. Typically, symptoms settle with the closure of the growth plate. To prevent recurrence, physiotherapy is advised as the initial symptoms have become better. Surgery may rarely be used in those who have stopped growing yet still have symptoms. So let's discuss physiotherapy, very important. Advised exercises include those to increase the strength of the glutei, hamstrings, quadriceps, and the gastrocnemius muscles. Use of an orthopedic cast or bracing to increase joint immobilization is needed, and it does not necessarily encourage a quicker resolution, though bracing gives comfort and helps to decrease pain as it minimizes strain on the tibial tubercle. Surgery. Occasionally, symptoms are not settled, and if patients are wearing a back splint during the day are ineffective, a support a separate ossicle in the tendon is usually the reason. So this is very important, this phrase, the separate ossicle in the tendon is usually the reason. So we have to remove it by surgery. Rehabilitation, it focuses on strengthening of the muscles, care training, and the control of the pain to restore the function of the knee. And rehabilitation, the non-surgical treatments for less severe symptoms include, again, I'm telling you, this is repeated. This is stretches to enhance range of motion and strength exercises, knee tape, and the knee braces, ice packs, anti-inflammatory agents, and the electric stimulation for controlling inflammation and pain. So rehabilitation continues. Quadriceps and the hamstring exercises are usually advised by rehabilitation experts to restore muscle strength and flexibility. And isometric exercises, for example, isometric leg extensions strengthen knee, decrease pain and inhibition, and assist in tissue repair via mechanotransduction. And rehabilitation continues. In the other exercises may include squats, wall stretches, and leg raises to increase hamstrings and quadriceps strength. This assists to prevent stress, pain, and tight muscles that lead to further injury, which oppose healing. And the rehabilitation continues. Education and knowledge on the exercises and the stretches are important. Exercises must lack pain and they should increase gradually with intensity. The patient is provided with strict guidelines on how to perform the exercises at home to prevent more injury. Exercises can include squats, leg raises, and wall stretches to increase hamstrings and the quadriceps strength. This helps to avoid stress, pain, and the tight muscles that lead to further injury that hinder healing. So, still, the rehabilitation continues. Knee orthotics like knee sleeves and patella straps, they aid in reducing force traction and avoid painful tibia contact by preventing unnecessary movement, rendering support and also providing compression to pain area. So let's now see the prognosis. It's mostly self-limiting. The good thing about that, self-limiting, as a result of an adolescent growth spurt, right? So this is a result of the adolescent growth spurt. Multiple subacute avulsion fractures and visible lump, which can be quite painful. And activities like kneeling can also irritate the tendon. The symptoms mostly resolve with treatment, but these can recur for 12 to 24 months, 1 to 2 years, before the full resolution at the skeletal maturity when tibial epiphysis fuses. In a few cases, symptoms do not resolve till patient is fully grown up. And the long-term implications, what are these? Osgood-schlatter disease is a result of combined effects of tibial tuberosity immaturity and quadriceps tightness. It is possible that migration of ossicle or fragmentation can take place in OSD. The result of OSD and ossification of tubercle may lead to functional limitations and pain for the patients in adulthood. Amongst people admitted with OSD, about half were the children between the ages of 1 and 17. This is the case. Epidemiology. Osgood-schlatter disease usually is present in boys and girls aged 9 to 16, thus coinciding with the periods of the growth spurts. It is more frequent in boys than in girls. It is been said the difference relates to a greater participation by boys in the sports and the risk activities than by girls. It was determined that the major cause for incidence for the disease was regular sports practicing and the shortening of the rectus femoris muscle in the adolescents that were in pubertal phase. 90% of the patients with the disease show pain during palpation over tibial tuberosity. The palpatory pain is the reason that the main diagnosis method is physical examination rather than the imaging, as the most bone diseases are diagnosed. Research suggests that Osgood-schlatter disease also increases the risk of tibial fractures. The rapid development of the tuberosity bone and the rest of the changes to proximal aspect of the knee with those who have the disease is the reason to that increased risk. This is a summary. Usual onset, males between the ages of 10 and 15, females between 8 and 14, duration few weeks to years, symptoms, pain, swelling and tenderness at the tibial tubercle, especially during activities like running, jumping, or climbing stairs. Risk factors involve overuse, repetitive strain, and rapid growth sports that involve running or jumping. Diagnostic methods based on symptoms. Treatment, applying rest, ice, compression, and elevation. The mnemonic is rise. And stretching, strengthening exercises. Medication is NSAIDs. Prognosis is good. And the frequency is about 4%. And this is the summary I have to present in the last. This is the normal insertion of the tibial tuberosity of the patellar tendon at the tibial tuberosity. And in Osgood-schlatter disease, the superficial portion of the tuberosity pulled away, forming separate bony fragment. Here it is. This is the separate bony fragment. Here, this is the traction apophysitis. And this is a magnified view of the involved area. Here you could see the separation from the fibrous tissue and a fibrous cartilage. Here you could see. And the growth plate at the hyaline cartilage, here it is. And this is the metaphysis of the tibia. Sorry. And this is the way with it, right? And this is the clinical appearance, right? You could see this is the prominence over the tibial tuberosity here. You could see this is my arrow. and due to the partly to the soft tissue swelling and partly to the avulse segments, right? This is way with it. Thank you very much, and I am very thankful to you for watching my video. Stay tuned for the next coming videos of the learning anatomy. Thank you very much.